Good evening everyone and welcome to the latest instalment of MSD's March Animal Health series, where tonight we're going to be talking about all things coccidiosis. I'm Helena Madden, I'm one of the ruminant veterinary managers with MSD, and tonight I'm joined by Seamus Quigley and Conor Geraghty. So we're up here in the best county in Ireland, which is County Galway of course. Seamus, would you mind giving us a little bit of a background to the farm and your system you're running here first before we get going?
Yeah, we're farming here in Ahascra, Ballinasloe, County Galway. Sucklers, we're running sucklers here, and we keep all the heifers onto beef, we sell some of the bullocks, and we're buying in store cattle and killing them for finishing after that.
Brilliant. Okay, so we're really going to try and dive into coccidiosis here this evening. So Conor, I'm going to start with you, being the vet and the expert. What is coccidiosis and what effect does it have on animals?
So coccidiosis is a parasite and it invades the wall of the intestines, and it multiplies there before it releases its spores or eggs, if you want to call them, and that damages the wall of the gut, and then it's often associated with a lot of bleeding, which farmers will notice as either black scour or maybe frank blood. But the damage it does to the wall of the intestine will first of all, apart from the initial sickness, will cause them to have ill thrift for quite a long time afterwards, and basically they'll never reach their potential. So essentially that is it. And
because of that then, what are the sort of signs we might see with coccidiosis?
So the most common signs is a black scour, or sometimes it mightn't be black if the blood hasn't started. You might see some calves do a lot of forcing or have tenesmus, as we call it, and obviously some calves then will be more prone to pneumonia as a result. You'll have a small number of calves in the group that will show clinical signs, which will have a lot more calves in the group that will be affected but won't have the clinical signs, but they'll still have the lack of thrive. So when we treat for coccidiosis where we have one or two calves in a group, we tend to recommend you treat the entire group.
And how common would you say it is?
It's very common and has been for decades. I suppose over the last 20 years we probably have a little bit better. Since the advent of Ecoxin, we have better means of treating it now, and also we understand the epidemiology of it better, so we can treat strategically in where we have known exposure. So we can treat the parasite before it breaks out and causes the damage to the gut. Whilst once the calves are exposed, they'll have an immunity to it. So people think it's kind of like a vaccine, but it's not. It's allowing exposure, but treating before they get the clinical signs.
Yeah, so that's important in the principle of treatment, which we'll come back to as well a bit on later. But Seamus, just to come on to you then, would you have had a history of coccidiosis on the farm or any trouble with it in the past?
Yeah, we're 20 years using Vicoxin, but if we treat 30 cattle and let out, we'll say 32, the two that didn't get out would have it within 2 to 3 weeks. It's definitely in the land, because there about 3 years ago I was going away for 2 days and I let out a bundle and there was 2 not done, and I wasn't 2 days gone and one of the beasts had it, the calf had it. So it's definitely in the land. So we're 20 years using it, and to be honest we don't let calves out without being treated with Vicoxin.
And that's a good thing you mentioned there, and just back to you Conor, where might they pick it up if they're going to pick up coccidiosis? So
they can pick it up in housing, or they can pick it up in paddocks. Every farm will be different that way, so we know that in Seamus's farm that they always get it in the sheds, but then when they go outside, if you get a wet night, that little bit of reduction in immunity in the calf will bring on the clinical signs, but they have it already, and that's why Seamus always treats them at around between 3 and 4 weeks of age. So once they're exposed, before clinical signs is the ideal time. Some farms then will get it in paddocks, so treating them before they go out wouldn't be the answer for them. You'd have to have that discussion with your vet and try and isolate where the exposure is.
Yeah, exactly. And Seamus, then what's your kind of approach to the system for when you might dose them or anything like that?
Tagging, the minute they're tagged, anything around here that has a tag is done for Vicoxin. And that's, you're talking about 2 to 3 weeks and they're after being born, and that's, if they have a tag gone out, they're done for Vicoxin. But I wouldn't go without using it, to be honest, because calves go back, calf goes back 6 or 8 months when he gets it. It really is hard on the whole system for them.
Yeah, and like you said earlier on as well, it's not just the individual ones with blood scour, it's going to affect the whole group. You know, and you'd always make sure to do the whole batch of them, because you've had bad experiences in the past, even just missing out a couple of them.
Conor always says when one has it, it's there. You know what I mean? It's in that group or whatever. So it's a case of just treating them all, and when you do anytime we treat them, we don't have an issue with it. It's just it's a standard thing nearly now. Tag and Vicoxin. That's it.
Yeah. And would you have noticed in the past, like Conor mentioned stress and stuff, like maybe disbudding the calves or anything, would that have caused an issue?
Yeah, well, like he said, like a wet night or something, like you might let them out and you think they're perfect and they could be for 3 or 4 days and you get a wet night and it's the next morning you're going to see that it's getting black even down along the leg, do you know what I mean? From the blood score, but it mightn't even be that clear sometimes. It's like brown, sometimes it's not necessarily black straight away if you see them early enough. But once they have it, they have it. Like, but it's like nearly a piner when they get it. Like, it really does. It takes a long time to come back from it.
Yeah, and I think that's an important part of the message with cocci, isn't it, Conor? That like it's not an individual animal disease; it's a group disease, and what you're seeing clinically is really only the tip of the iceberg.
Tip of the iceberg, exactly. So I mean, it's any disease depends on the interaction between the individual animal, the disease, and the environment. So it's the ones that are under pressure. Maybe lower immunity for some reason that will have the very bad blood score, but the rest of the group that they're there, they have it as well, and it will affect their ability to absorb nutrients and thrive. So definitely it's a group thing.
And if you missed it, like it could be too late nearly by the time you realise that cocci's been causing damage in some situations.
Well, say once the intestinal wall is damaged, you know, like there'll be scarring on that wall, so they won't have the same absorption area to absorb nutrients. So by definition then they won't thrive as well, you know. But certainly for farms that have got on top of it and realised how to treat it, it has made a huge difference in the bloom on the calves and also the thrive, but also then reducing other things like pneumonia and stuff to go with it.
Yeah. Basically if it's there and you're not getting on top of it, it's kind of taken away from everything you're putting into the calf. And it's really hitting that feed conversion efficiency as well, isn't it? That you're not going to get the most out of them. And just saying as well, Conor, like diagnosing cocci, or if someone's suspicious they have an issue, what's the best way to go about getting to the bottom of that?
Diagnosis is fairly straightforward. So I mean, if you take a fecal sample or a dung sample, you know, they're readily diagnosed either in the lab or by microscope or one of those new machines that are going now. They'll all diagnose coccidiosis. So it's quite easy to see. You can get low levels coming back routinely on fecal samples that you wouldn't be concerned about, but once you see a clinical case on a sample, like it's high levels of oocytes on the sample. So
and a lot of just to come back to the kind of principles behind treatment there and what you were saying, where we want them to get a bit of exposure so they build up immunity, but we want to get in before they're clinically unwell with it. That then probably determines, and it's part of Seamus's system, what the timing of treatment is. So it might be based on the history of the farm. Yeah,
so I mean, if you know where exposure is, like essentially it's a 3-week life cycle, and you'll get rupture of the oocysts that's probably about 14 to 16 days, 17 days. So 10 to 12 days after exposure is the ideal time to treat, because you'll have they'll be exposed and they'll be developing an immune response to it for future exposure, and you'll treat them before the damage is caused to the intestine. So that's where we'll be looking for. If you know you have an issue in a particular paddock or a particular shed, that, you know, get in there 10 to 12 days after they go in there, and then that should
and that's probably what happened with your two Seamuses. They went out to that paddock, and that paddock just has coccidiosis in it, and probably will for forevermore.
Well, I knew because we were busy at the time and the two were missed, but they were to be done, but they were left, and sure, they got it. But it just takes a long time for an animal to get going again. As you said, the damage is done. So it's cheap in the long run. To prevention is better than cure, in my eyes.
Exactly. And that's another part of the problem with cocci, isn't it, Conor, is how well it's able to survive. Like, it'll survive away in a field from one year to the next.
It'll survive away in the field, and even like we had farmers that would have steam washed sheds and disinfected them. Very hardy parasite, and certainly very, very difficult to get rid of from any building. And obviously you can't disinfect the field, so
Yeah, and if you were to go about managing it in the shed, you obviously do need to be aware of what type of disinfectant you use.
I mean, like the attention to detail will be very high compared to a normal cleaning of a shed. You know, you'll really have to get into all the crevices and use the appropriate disinfectant.
Yeah, exactly. Well, I think, in fairness, Seamus, your calves are a testament to good coccidiosis management, and Vicoxin a little bit. We'll take that one there. So it's great to see someone that's, you know, seen the effects of it, but now has a really good, solid control program, and you're more than convinced, and I'm sure telling others about how important it is to to get in ahead of it and work on a preventative method as opposed to wait until you have a problem.
And it's like I said, it's like the tag. It's the next thing around here. When they get the tag, they get the Vicoxin, and that's it. But it's prevention is better than cure, because it's 6 to 8 months the animal before it starts coming back again. Like it's hard on an animal.
Yeah.
So that's my side of it, and I wouldn't change anything with Vicoxin.
Brilliant. Okay, Conor, so I might just come back to you there again, and we've spoke about Vicoxin and the importance of the timing with that. Is there other management strategies that someone might need to take into account if they're really under pressure with coccidiosis?
Yeah, well, obviously there are areas on the farm, if you have a big problem, that are highly contaminated with coccidia. And I suppose the thing is, you have to either limit the exposure to young animals to these areas, or try and modify them that they're less exposed. So with sheds, cleaning and disinfection, as we said, while it's difficult, it will reduce the exposure. And outside then, it tends to favour moist, wet areas or muddy areas. So water troughs, gates, gaps, that sort of stuff. Maybe improving the underfoot conditions there. So a lot of farmers would say with sheep would have 804 or similar stone fill under water troughs to keep the underfoot conditions correct. And moving troughs as well, if you're feeding creep feeders or the likes, if you move them to fresh area, it avoids the build-up of any parasite or any bacteria. So those sort of things do help. I suppose the issue is that when they come back, depending on the age of them, when they come back into those areas, and you tend to see around sheds, there's always paddocks around sheds that are used for young animals, that the exposure will be there. So it depends on the farm, but there's certainly things that can be done to help as well,
To degrease the load, because the more of it is there.
Yeah, well, the difference in the high load and the low load is the high load is sometimes overwhelms the animal, and you get severe disease that's hard to cure. Whereas, with any disease, if it's mild, it's easier to cure,
Yeah,
so.
Yeah, exactly. But ultimately, and we've probably said it a couple of times now, like, we do actually want them to get a bit of exposure.
You want to get exposure, but you don't want to get that they're overwhelmed with exposure, that they go down. And it's the same principle as it is with cryptosporidia or any of those diseases,
Any infectious disease, especially ones that build up like that in the environment. And just actually, Seamus, to come back to your protocols again on it, do you just do them once, or would you find you need a repeat treatment ever?
No, once. If they're done 2 to 3 weeks, I don't genuinely never have an issue with a problem again after that.
Yeah.
It's covered and done.
Which is a really good sign of how good the control programme is working.
Yeah, I'd say for people that need to repeat it, it's probably that they've gone in too soon, that they haven't been exposed, and I suppose that's where the one size doesn't fit all, that you need to understand where they're getting exposed on the individual farm, and then treat about 10 days after that if you can. So, it can be a bit of trial and error on that, but.
Yeah. But if you have a history of it, you probably have a bit more to work on, and definitely always contact your vet to discuss all of that, because it can be a little bit complicated trying to figure out what's the best way to go about it. But I think, to be fair to Seamus' system, and we know it's working well, it's a great sign of how, when you do think about it and you're strategic, you're not having to use as much dose, and then you're also, in the long run, those animals are developing an immunity, and even if they meet cocci later on in the year, they're able to cope with it. Just to move away from the calves then, Conor, lambs obviously get cocci as well, would you say?
Yeah, they get coccidiosis, a different strain obviously than the ones that the calves get. And we certainly see it on a number of farms. And again, it's linked in with immunity. So you can see outbreaks of coccidiosis in tandem with nematovirus, for example, if the animals are under pressure. I suppose there's been a good bit of work done on building up immunity in lambs, and if they are exposed in their first 48 hours, they will build an immunity to it. But there's a challenge in that, because it's hard to get lambs out within the first 48 hours unless the weather is very, very good. And oftentimes it's 72 hours before most of them get out. So again, we would see the most common thing you would see is a scour that looks like possibly nematovirus early on in spring. You can have a lot of losses with lambs because it just pulls the lamb down a little bit immunity wise, and you can see them having more cases of meningitis, pneumonia, things like that you may not relate to coccidiosis unless you take a sample and maybe investigate a few post-mortem cases or whatever. So certainly farmers that have an issue know that it's something they have to keep on their radar. But oftentimes, if I say to farmers, if you think you're getting more bad luck than you deserve, is often a reason for it, and that would be one of the top 3 reasons for poor performance in the early lamb's life. You know, so
Yeah.
that'd be always something we'd be watching out for.
It might kind of manifest as something different, but you might have to
Yeah,
think,
and
is there...
it may not show as the typical black scour. You know what I mean?
Yeah.
So it's something to keep an eye on.
Yeah, but it might be that you're thinking, is there an underlying stressor here, meaning I'm having more issues
Yeah.
with this particular disease,
Yeah.
and coccidiosis is something
Yeah,
to...
so on the fecal samples, there was huge levels of coccidiosis, and we treated for the nematode iris first, and then the coccidia subsided. So it is an immunity thing as well, you know.
Yeah. And the coxin is fine to use in lambs as well.
It is, indeed.
Yeah. Okay, so we've had a great overview there of coccidiosis from a farmer and a vet's perspective. Just to finish off, we're going to take a few questions from the audience. So, Conor, I'm going to come to you first. A question that we've had come in. I have a couple of calves with blood scour. What should I do about it?
Well, I suppose those calves in particular need to be treated. So not alone do they need to be treated to kill the coccidiosis, you need to treat the clinical signs. So the clinical signs are fluid and blood loss. So replacement electrolytes will be an important part. It's quite a painful condition, so some pain-killing medication. If they're running a temperature, it probably needs to be covered with antibiotics, but your vet will discuss that with you. And sometimes we would use something to ease the passage of fluid through the gut, so something like kaolin powder or other astringents. Once you have a couple of calves in a group with coccidiosis, then you can be sure that the entire group have it. So really and truly, they should be all treated for coccidiosis.
Yeah, so again, not an individual animal thing.
Exactly, it's a group thing,
Brilliant. Seamus, on to you then, a question in, how much Vicoxin are you using per calf?
Well, I treat all our calves with about 40 ml per calf, and once only, and don't have an issue after that.
Yeah, and that's at in around the 3 weeks of age.
About 3 weeks of age.
Yeah.
I don't see the point in doing any when they're too young, you know. So 3 weeks on, they won't be done.
Well, it'll be towards weight, so I mean, they'll be strong, surely suckler calves, so they'll be heavy enough.
That'll be a good dose for them.
Yeah.
Perfect. And then just finally, Conor, one question on Vicoxin. Any restrictions on the weight of the calf that you can use it in, or anything like that with Vicoxin?
No, it isn't very toxic, so you can use it right up to. We would often see calves with aged calves up to 2 months with coccidiosis, and you can treat accordingly to weight, so you're not restricted there. And the same with lambs, so you can treat animals of all ages with it. Yeah.
Brilliant. So you have great flexibility then with using Vicoxin, basically. Yeah. Okay, folks. So thanks a million for tuning in and joining us tonight, and thanks a million to Conor and Seamus for having us here on the farm today. Do tune in to our next episode, which will be all about the fundamentals of fertility. So thanks a million and good night.